Hello, this is Tracy Harrison from the School of Applied Functional Medicine, and I am so excited about joining many of you at the NCIMS annual conference, Synergy, in just about 6 weeks from now. I will have the pleasure and the privilege of speaking with an awesome docket of speakers, actually, many of whom I've heard speak before. You're in for a treat. But I'm going to be talking about myths and missteps and clinical tools for navigating perimenopause. I've been saying for years that whether your expertise is metabolic dysfunction, autoimmune disease, longevity, long COVID, regardless of your expertise, you need to learn to really master the common functional imbalances at play in the perimenopausal woman. Why? Well, because the most common patient or client who's going to walk into your practice looking for functional medicine support for chronic suffering is a woman in her 40s. And therefore, statistically, it's almost certain that she's going to be in some stage of perimenopause that is going to be markedly affecting the other challenges that she's wrestling with. And in progressive medical and wellness communities, the hot topic for several years now has been bioidentical hormone replacement of sex hormones. And this is an important conversation. The why, when, what method of delivery, how long, and what does the research actually show about the safety and efficacy of bioidentical hormones? This is important. We're going to talk about that a little bit. But I want to expand the conversation to the functional imbalances beyond estrogen and progesterone that are very often at play and are markedly exacerbating perimenopausal symptoms and suffering or creating completely separate dynamics on their own. Sometimes we're quick to blame fluctuating hormones or progressively lower levels of hormones, but dynamics like withdrawal of oxytocin and GABA glutamate imbalance, or histamine overload, or androgen dominance. These are common functional dynamics at play in perimenopause that you don't want to just be peripherally aware of. You want to have true capability and confidence in working with them in your practice. So I can't wait to be with you. My session is going to be a very practical one that talks about the reality of life during this transition in every woman's aging. Because after all, unlike so many other things we tackle in functional medicine, perimenopause is not a disease, it's not a diagnosis, it is a progressive transition in life. And contrary to what we used to think, it's not typically only 2 or 3 years long. It has marked phases that usually last collectively 5, 6, 7, 10 years. And so we need to become truly savvy at partnering with each unique patient and client to help them to understand what's at play in their unique body and transcend the limitations of protocols to actually customize a partnership, an interventional plan that can address what is at play in their unique body. So I can't wait to be with you in just about 6 weeks at Synergy.